Too Bright to Light, a smoking cessation program by Kayla Catalano, Kara Evans, Grizel Mendez, and Ruth Neget. Lowell, Massachusetts is located in Middlesex County. It ranks in the top 20% in smoking prevalence in the state. Lowell's percentage of smokers is about 6% higher than the state average. Less than 27% of its smokers have less than a high school degree. This city has a nursing diagnosis of risk for impaired respiratory function related to smoking, as evidenced by the smoking average of 22% as opposed to the 16% of the state average. Applicable objectives from Healthy People 2020 are implementing policies to reduce tobacco use and initiation among youth and adults, and adopting policies and strategies to increase access, affordability, and use of smoking cessation services and treatment. Among teens, there has been no nationwide increase in the use of tobacco products, but there has been a statewide increase in the use of smokeless tobacco and cigars. Because 24% of the population is less than the age of 18, our target population was adolescents and teens between the ages of 12 and 17. Our agency was the Boys and Girls Club of Greater Lowell. It is a non-profit organization and is funded through individuals, corporations, foundations, government agencies, and low-cost membership fees. The Boys and Girls Club serves about 1,600 boys and girls ages 7 to 18. Over 200 members attend after-school programs, and at $26 per member, it makes it easy for low-income families to afford it. The goals for this project include increasing the awareness of smoking risks through education, demonstrated by the completion of the pre- and post-tests. Also, increasing the amount of adolescents willing to remain smoke-free, demonstrated by the signing of the non-smoking contracts. The plan for this project included 3 phases. Phase 1 served to evaluate the baseline knowledge through an interactive questionnaire, serving as a pretest. Phase 2 was an educational presentation and activities involving adolescent participation. Phase 3 was a quick review of information, evaluation of goals and outcomes with post-tests, and the no smoking contract. This also included the raffling of donated prizes. Some resources used were the Center for Disease Control, the American Lung Association, the American Cancer Society, and the Boys and Girls Club staff, Diana Regis, the team coordinator, and the athletic director, William Gilmore. Donations were provided by the Lowell Showcase Cinemas, Roller Kingdom, Walmart, Stop and Shop, and the Massachusetts Health Promotion Clearinghouse. Both Erickson's and Piaget's theories guided us in developing a teaching method. An affective domain of teaching allowed us to connect with the teens by focusing on what they valued the most, such as appearance and the opinions of others.
Due to the population's developmental stage, we focus first on the short-term consequences by showing real-life examples including yellowing of skin, teeth, and nails, and odors and stains on clothing. We also discussed the cost of smoking relative to what adolescents would like to purchase, such as video games, iPods, and cars. The short-term consequences produced the most amount of questions, suggesting that their value of appearance was of high importance. The teens were asking us questions such as, how long does it take for your skin and teeth to yellow, and does it also apply to marijuana? The major focus for our lecture involved COPD, cardiovascular disease, and cancers. Focusing on the visible consequences like these photos encourages students to ask questions like, could this really happen to me? And why is this person's foot like that? The interactive straw activity, which required them to breathe through different sized straws, was used to emphasize the changes that occur in COPD. This activity produced comments such as, it's so hard to breathe through this. Although the Boys and Girls Club gave us access to approximately 52 adolescents, the education room was not large enough to fit the adolescents and accommodate for our original implementation style. The presentation style was changed into an active lecture presentation with various interactive activities. During the pretest, we asked volunteers to read the questions aloud, which took longer than expected due to disruptions by the participants. At the end of the presentation, the post-test was given, which included similar questions to the pretest. About 80% of the participants answered more than 7 out of the 10 pretest questions correctly, and 100% of the participants answered 9 or more questions correctly in the post-test. Obtaining an implementation venue and donations was a difficult process. Also, the large crowd of adolescents was challenging to keep everyone focused in a small room, and the length of the presentation was also challenging for the teens. Due to the size of the crowd and the room, we had to change our presentation style from small table presentations to one large group presentation. Some of the adolescents who were smokers were opposed to the anti-smoking presentation and reflected their beliefs onto others. We utilized the youth counselor to help keep the teens focused. We also facilitated the activities as a group in an active lecture style to keep the presentation moving along. Then, we allowed the teens ample time to explore the presentation materials ahead of time, and we distributed snacks prior to the presentation. Some recommendations for future presentations include obtaining a larger room for the presentation, setting up tables in the appropriate position the night before, and changing the presentation style to involve the teens in discussion groups of 6 to 8 members. This would decrease the amount of disruptions and aid in keeping the teens focused during the presentation.